The biggest thing I would say is most people are far, far more aggressive and hard on scars than they need to be. Scar tissue responds to a really soft touch. And historically, like the old school kind of way of treating scars was to go in really hard. But actually, let's break that down. Scar tissue is a result of the inflammatory process, right?
Yeah.
You have an injury, you go through inflammation. What does inflammation do? It creates scar tissue. So why would you want to come onto a scar with something that's going to really inflame it and potentially produce more scar tissue?
You are the well-being wisdom warrior, the heartfelt healer,
the luminary leader,
the health harbinger,
the shaman, the witch, the guru, the guide of humanity to an embodied, enlightened future.
Welcome to the Well Pro Show, the podcast for wellness pros,
where your wellness lifestyle is your core leadership strategy.
Experience the camaraderie of collaborative colleagues,
where your job as a wellness pro is to guide the transformation.
You are the resistance, the future, the way forward.
You are the community counselor, the change maker.
The Well Pro Show, brought to you by futurist thought leader Kate Stillman and the team at Wellness Pro Academy. Made for you, by us.
Hello, everyone. It's Kate Stillman with the Well Pro Show, and I'm here with Emma Hawley of restoretherapy.co.uk. And Emma has a course called Scar Therapy, Courses for Physical Therapists. And that's really what I wanted to talk to Emma about, because I know there's so many wellness pros in Wellness Pro Academy who don't really understand how to diagnose some of the side effects from scar tissue. So sometimes we don't even know, what people's digestive pain is from, or their constipation, or their bloating, or even nerve entrapment that might cause leg pain. And I'm really going to let Emma, you get in, because you're the pro on this, like more into like all the symptoms. Like, let's just start with what symptoms people may have that have internal adhesions from scar tissue.
Thank you, Kate. Yeah, it's great to be here, and it's very kind of you to invite me along. Scar tissue is such an undertaught kind of thing to look at and assess, and it's really fantastic that you're trying to bring a bit more awareness to the community about this. If somebody's got a scar, particularly if it's in the abdomen, depending on the research papers that you look at where they've actually gone back in to do more surgery because scar tissue is causing a problem, it comes up between 75 and even up to 95% of people who have scars have got internal adhesion. So that's sticking between layers of tissue that's normally separate. And it can be really obvious if the skin is sticking down to underlying layers, because then normally, even if the person's quite slim, if they stand up and their muscles engage, they then would have a kind of puckering or a folding. Which, a lot of the time, if we think about women after C-section surgery, if they've had an abdominal delivery, then they're going to end up with that puckering. And so there would be a cosmetic concern often initially, because some of the scar tissue that starts wrapping around the bowel and can cause other much more frightening complications. I mean, we saw Elvis Presley's daughter recently died because of complications following her surgery for weight loss, which was to do with the fact that the surgery had continued to produce scar tissue over the years.
Was that a stomach staple, or what was the surgery?
She had a weight loss surgery. I haven't gone in to look at the exact details of which one she had, but basically any surgery in the abdomen is going to put you at a higher risk then of getting adhesions, which can, the biggest thing is if they constrict the digestive system, particularly if they constrict the bowel, and then you can end up with obviously a perforated bowel, and you've got all of that highly, toxic matter, which can then very quickly lead to death if it's not treated. And people are often ignoring, somebody who's maybe not had a healthy relationship with food. They could be ignoring the symptoms, which would be, it might start with simple bits of bloating, maybe that they're having IBS type symptoms. So it could be a mixture of diarrhea or constipation. If everything's constricted, certainly you'd imagine that they're not going to be passing their stools as regularly. And particularly if somebody's had parts of their digestive system removed in order to reduce calorie consumption, that in itself is going to have an additional strain on the fact that the body's got less it's able to take less nutrients from the food, and therefore it's not able to repair cells in the same way because it's probably nutrient deprived. It's a really fascinating thing once you start looking at it. But people could also have like localized pain would be really common, and pulling sensations. If you imagine like one layer of the body is stuck down to another, when you do a movement, it goes to the end of range. So it could be going into an extension. If you've got a scar, like a big abdominal scar, then you would feel that the scar would be tight and restricting movement. And so that often plays out with other symptoms presenting because our body has great ways of compensating, or we just stop doing movements. You find women with cording after breast cancer, they'll very often start bringing everything in their life down to a level where they can reach things without having to go the full stretch because it hurts.
And so is some of this, I mean, I'm curious about where like scar tissue and fibrotic tissue, if we look at like radiation, so say someone's had, like you said, breast cancer and they have radiation and then they've got fibrotic tissue, how does that play in? Like is there a difference between scar tissue and fibrotic tissue?
Well, fibrosis is something used to describe tissue that is stiffer, and scar tissue comes under a classification of fibrosis. But then you get this syndrome that is a result of radiotherapy, which is called radiotherapy fibrosis syndrome. And it's because the radiotherapy actually can change a protein in the tissue, and it creates stiffer tissue over a larger area. So people can end up with stiffer, thicker tissue, which is less mobile, again, can lead to pain, and it's an inflammatory condition. So it can be, it can trigger all kinds of things because you've got
including cancer. I mean, that's part of the problem. Is it's like, I mean, from what I've read in the epigenetic studies on the radiotherapy tissue, is that because the epigenetic environment is so limited in terms of, everything from oxygen exchange to nitric oxide movement, that you actually then, so it's kind of like a bit of a cat and mouse game, right? If someone's had any of the surgeries.
I think it's really hard. I mean, radiotherapy has got, after removing the tumor physically with surgery, it's the next most effective tool the medical profession has had, in terms of its effectiveness for getting rid of cancer cells. After cutting them out, radiotherapy is much more effective than chemotherapy. We're comparing the two. But like with all things, whenever we go through a medical procedure, it's generally going to have a consequence, and that consequence takes its toll on the body. And certainly they are fine-tuning the way that they apply radiotherapy. There's been leaps and bounds from people who were getting radiotherapy in the 70s, which was just hugely traumatic to the kind of issues that they got left with. Whereas if you compare that to what's going on now with the way that they're giving lower doses, they're trying to target the doses better and all that kind of thing, then that makes a big difference.
Okay, so we've got people that have had C-sections, people that have had hysterectomies, people that have had whatever cancers in the GI tract, from cancers in the breast. Like we have all this. There's scar tissue. There's also, I know, from even like
surgery, you may get less superficial adhesions, but internally they're still going in. And particularly the higher risk will be where there's inflammation. So like an appendix that was almost at the point of bursting or that burst is much more likely to leave a complex scar with adhesions than something that was caught a bit earlier on. Whether or not that person's a smoker, whether or not they're anyway inflammatory, have they got a good diet, how did they respond, did they get an infection? So all of those things play into.
And my experience too is if like say the genetic say their like ancestral health history tends towards stenosis, right, or tends towards arthritis and stenosis, that like even with good diet and lifestyle, or pretty good, and then you put something like this on, all of a sudden the body's like, I know what to do, we're going to lock everything down.
Yeah, definitely. I mean, some individual and people might have heard of the term like keloid scar. So that's it's in the scale of different kinds of scars you can end up with. It's kind of like the one you really would want to avoid. And there's lots of research that says that is very much genetically driven. Not always, but it is one of the big factors is skin coloration and family history. So whether or not you've had that in the family will play into that.
So I'm curious too about, because I know there's some studies on even scar tissue as a result of an endoscopy, colonoscopy, and I'm kind of curious about the ones for, some like colposcopies, which are for women who are high risk uterine cancer, where they're actually like cutting out cells in, they go in through the vagina, through the cervix, they cut some cells. My guess is like you don't really cut without ending up with some level of scarring or fibrosis.
Yeah, although that would likely be less traumatic for the body. I think one of the things I notice is when you've had a big open surgery,
Yeah.
so whether that's abdominal or somewhere else on the body, the tools that are used to retract during the surgery, so to open up the body and the drying of the tissue, which consequently happens because of that, because they want to get good visual access, is one of the things I really notice. Like, our body is designed to be a moist internal environment, which at least if they go in with these kind of surgeries that you were mentioning, they aren't actually exposing tissue that's normally lovely and moist to as much drying. Although with some abdominal surgeries, they will fill the abdominal cavity with air in order to do the surgery.
To separate the tissue and see the stuff. So then you've got the air. I mean, my background's in Ayurvedic medicine, and we look at 5 elements of air, ether, water, fire, earth, and it's like air. It's drying, it's mobile, it's dispersive, and it ends in hardening, right? And ends in hardening, and that's where you got.
And that's exactly what I see in my practice. That's totally, exactly as you've said, when it's exposed, the tissue doesn't like it. And so it shortens and it tightens. And so a lot of what I'm doing when I'm training therapists is, how do we flush this with the body's own, how do we get the body to bring the blood supply, but the lymph supply and the interstitial fluid, how do we get all that moving in this tissue that's basically kind of locked that stuff out?
Yeah. So, okay. I, just as a practitioner, myself, and having seen, whatever, hundreds, thousands of clients, I know like the questioning process is really important with diagnosing what's going on. So part of what I'm wondering is if we're not trained, and whatever our training is, whether it's physical therapy, whether it's Chinese medicine or Ayurvedic medicine or chiropractics or whatever, if we're not really aware of how many surgeries are happening right now, like hip replacement surgeries or different types of abdominal surgeries, or like you mentioned, the like the weight loss surgeries, like if we're not really thinking about scar tissue, like I imagine you, Emma, like you got scar tissue on the brain, right? Like you're like someone talks to you about anything and you're just like, what are your surgeries, right?
Yeah, totally.
And even if it was 10 years ago, right?
People don't mention it. There's various reasons. So people might block out a surgery because they think it's inconsequential to the patient history that you're taking. They might say, I had a C-section. Well, that's not really a surgery. I was just having my baby. And you're like, oh my God, that is such a big surgery. And the fact is you didn't get a normal recovery because you had a little person to look after and you were being woken every couple of hours. So your body wasn't in a normal regenerative state. Then you get people who've had an injury which was traumatic for them, or a surgery. It could be something that we might think, well, that's quite a straightforward procedure. But if they had lots of anxiety around it, one of the ways we cope with that is just kind of like forgetting about it and moving on. And I think, by the time—
And that really happens with cancer or scary, like irritable bowel type surgery, where like people are just like, I just want to be on the other side of it. I want to forget it.
I don't want to talk about that, and they maybe don't want to revisit that. So I think that's a really important point. And so the thing is when you're taking that patient history, first of all, is just kind of maybe having it as a little question on your list of, can I ask you, have you had any surgeries? And very often, even if you've got that question, you may only get the most recent one and then subsequently find out, oh yes, I had a little laminectomy, a few years ago. And it's like, well, you've come into my clinic because you've got back pain. How can you not tell me? I'm looking at your back and going, there seems to be a scar on your spine here. So that's really important. And the other thing is physically, if you're a practitioner where you're doing a manual treatment where the person is removing clothing, have a good look at the parts of the body that you're working on to see, can you visually see any scar tissue? And then what I tend to say is you want to, with your hands, just go either side of that scar and check how mobile it is, check for tissue stiffness, so you're really feeling around the area. And if it feels distinctly different from the tissues around it, then you should be thinking, well, this probably could benefit from some softening, some hands-on treatment to try and kind of get this mobile and moving.
And the distinctive difference is going to be mobility, right? Like where if you feel tightness, hardness, a difference in texture.
Yeah, texture and mobility. So you could find that if you literally get the skin and put your hands either side of the scar and just slide the tissue in one direction and another direction, that you might feel that it's restrictive movement compared to if you can like the other side of the body or a similar area of tissue which hasn't got a scar in the middle. Or it could be that if you actually kind of push the tissue, that it doesn't want to lift up. So if you come either side of a scar, a bit like you're going to squeeze a really big spot, a scar will often be so tethered down that it won't lift up. Whereas normally if you pinch somebody's cheek, you imagine that you get a bulge. If you sort of do a gentle pinch on a scar, sometimes it won't bulge up because it's so stuck down. That tissue literally is being pinned from lifting up. So I'd say test sort of laterally whether or not the skin moves up and down and around, but then also just kind of come a little bit underneath it and see if you can get it to lift up, because they're showing different characteristics. That's a good way of assessing different characteristics.
And so if you can feel the hardened tissue under like the line of the scar, is that like, that there's not that sliding quality that you're talking about between the layers of.
Yeah, because what we want is, we're learning more and more about how essential our fascial network is, how our fascial tissue actually helps to carry load, and that the way that our bodies work are not just individualized units of a hand and a leg. We're connected up and we move as a whole unit, and we need the whole unit to be as well functioning as possible. And therefore, if one bit of that unit is totally stuck, everything else is having to work a bit harder to compensate from it.
Right.
So we all know when you've got a client who's, starting to get lots of arthritis around their knee, they change how they're moving. Arthritis is creating a type of scar tissue. It's painful. So they adapt their moving patterns. And then that generally means that they end up with another ache somewhere else, because that's not that healthy to totally offload through a key joint.
I mean, and this to me is where it gets so confusing. I think if we're not awake to what scar tissue can do, it's like someone might come in, they might think they have like a labral tear when it's really just an adhesion from like a female surgery or from a colon surgery or like reproductive organ surgery or a digestive organ surgery.
And the thing is I had a lovely therapist who came. She lived right in the top of Scotland, and she'd had a C-section. I think it was over 5 years ago, but maybe it wasn't quite 10 years ago. And she'd had all of this hip pain ever since. And she felt very convinced that it was it to do with her scar. But she'd been for scans, and they were ready to give her a hip replacement, which she was very resistant to. And she came along and started learning the scar techniques on the course. And within a day, her pain had gone. And she came in the second day and was like burst into tears and said, I would have gone with that hip replacement because that's what I was being told the problem was, even though in my heart I felt that doubt. And I'm a therapist, and let alone all those other people out there who potentially are being signposted, because if you go to a medical person who's got no idea how to assess a scar, they're going to start scanning you. And many of us have got deterioration in our joints. And then if you've got a pain deterioration, what's the next logical step on the medical pathway is, well, okay, that must be the cause, and therefore let's bring in some surgery and take that joint out. I mean, it's quite frightening really to think how many times.
And then after the surgery, now we have more scar tissue just to like play the whole thing out.
Yeah. More scar tissue, a compromisation of that joint, and potentially still the pain, because that wouldn't have solved her problem.
Right.
She would have still been left in pain, and then they possibly would have been looking at other exploratory surgeries to find out what it was.
Right. And every time we explore, this is what, to me, this is where it's like testing's not neutral. Exploratory surgery is not neutral. Like there's not a neutrality. It's not like sitting down with a pen and paper and taking a test. You're opening the body up. The body's going to be protective, right? And if anything's injected, like you're saying, like air, like there's going to be a total change of the epigenetic environment around an already traumatized part of the body.
Yeah. So my big passion is obviously it'd be great if more people could access somebody who was trained in this so that they could get this treatment. But the other thing is if you know you're going to have a scar, what should we be advising to make that scar as good as possible? And this again is a massive area where you kind of assume that when you get checked out of a surgery that they're going to give you really great advice on how to optimize your scar to make it less fibrotic. And if you're lucky, you get a really basic physiotherapy program, and perhaps if you get keloids, you might be told to use some silicone, but certainly many medical centers are not really giving clear advice on some simple scar massage, moisturization, which is actually really key and fundamental to reducing inflammation and stopping internal scar tissue production. And these are really simple basics, that why are we not getting this information out there? So that's been that's what I've been championing.
That's why you're on the Well Pro show, because I could find you in trying to find people that are talking about this, because it's such a big problem.
It's happening all over the world, and there's so few people talking about it. And then you've got to think about, reducing inflammation. So if somebody knows they're going to have a surgery, get your diet right beforehand. If you had an accident, and that you are reactive, let's get those inflammatory factors down. Let's cut out things that might trigger you. Let's get the gluten and the sugar and the alcohol out of your system. So that at least
exactly what with like Wellness Pro Academy, we teach wellness pros to run clubs that are based on their convictions and values, and then their habits, and then their competencies. So it's like, because what we know, say you're a scar tissue therapist, it's like, because your clients need diet and lifestyle changes, like organize the solution around that. And that we can't, it's hard to make change when you feel like you're the only one. And people only go, oh, poor me, I can't have alcohol. Oh, poor me, I can't have sugar. Oh, poor me, I can't. But when you're in a club of people that are like, wait, no, I can feel better. If we all do these things, we all feel better. There's a sense of identity shift, momentum, belonging. I'm not the only one. It's not, oh, poor me. It's like, oh, we all got to do this. All right.
Yeah, totally. Yeah. And I think that's so important. I mean, there's the whole kind of social prescribing and getting people together is all part of that, isn't it? When you do things alone, they feel so much harder. You get people together and it's fantastic.
Totally. I had an event for my members a week ago, and I have some land on a creek that's like basically like snow melt. So it's about 37 degrees Fahrenheit. So freezing, you guys. And, we just sit in the creek for, long time, because people are like, oh my gosh, it's so much easier to do this together. And it's like, yeah, it's so much easier to do hard things together,
Oh, incredible.
Yeah.
Gosh.
So tell me now, what's that?
Would I want to be there? I would maybe if I had people around me.
Yeah, exactly. No, that's just it. That's why we leverage the club model, because it's like, hard things are hard when you're the only one. Hard things are fun when everyone's doing the hard thing together, because if everyone's kind of breaking out of their chronic inflammatory pattern and the personality that goes with that pattern, what happens is it gets fun, it gets interesting, it's funny, it gets emotional, it gets accessible, and then people bond, right?
Yeah,
they're in it together. They're not just holding on like the scar tissue. Okay, so tell me this. You've got now someone's aware as a practitioner that they're now going to ask more questions about surgeries and invasive procedures and invasive testing when a client comes in about, whether even it's about leg pain or back pain or hip pain or digestive imbalances or inability to raise their arm above their head or any of that. We're going to do a proper, see what's going on with these scars. We're going to palpate. We're going to see how pliable the tissue is under, if that's part of our scope of practice. We're going to refer people to your courses for scar therapy practitioners. So especially for the people who are already doing hands-on healing, that they can get a proper education about how to work with people with this. Will you just go over a bit of what is some of the protocol that you walk through in your scar therapy practitioner certification?
Yeah. So in terms of sort of patient advice, or what the actual manual therapist might do?
I think manual therapist, and then both. But I would start with manual therapy, just of if that's okay with you. Because I know so many people in my Well Pro community, they have these scars themselves, and they're going to want to they're going to want to start, getting a little bit more aware of, are there underlying adhesions?
So I think my totally the biggest thing I would say is most people are far, far more aggressive and hard on scars than they need to be. Scar tissue responds to a really soft touch. And historically, like the old school kind of way of treating scars was to go in really hard. But actually, let's break that down. Scar tissue is a result of the inflammatory process, right?
Yeah.
You have an injury, you go through inflammation. What does inflammation do? It creates scar tissue. So why would you want to come onto a scar with something that's going to really inflame it and potentially produce more scar tissue? So what you want to do is you want to come gently onto that scar. We want to hydrate it. We want to stimulate it. We want to mobilize and soften the tissue. And we want to encourage a turnover of cells to try and get more healthy cells in that area. And the way that you do that is by going gentle, not by going really aggressively. So one of the biggest things that I hear all the time when I'm first demonstrating techniques is like, is that it? Like, is that all you need to do? And so for the manual therapist who's maybe out there doing lots of sports massage or deep stuff, they love it because they can be sitting down, their hands are gentle, soft and relaxed. And that also is about getting, if we think about when is our body renewing, when is our body most accepting and in receiving treatment, it's not when we're in fight and flight and something's hurting us. It's actually when we relax. Our cells renew best when we're relaxed, when we're sleeping, right? So we want to get a client in, we want to get them to feel nice and calm and relaxed. We want to come with a soft touch, and we want to work on and around the scar for a sustained amount of time. So even on quite a small scar that's maybe only 5 or 10 centimeters, I may spend 15 minutes working around that area. And then there's other things you can use. You can do obviously techniques with your hands, a bit like massage techniques, but take them down a notch in terms of pressure and respond to the depth that you feel the fibrosis. So if you only have to touch the skin and it feels really hard, that's where you start work. You don't start by pushing down really hard. And if you're used to doing kind of deeper fascial and muscle treatments, you'll be used to kind of like leaning your body weight on, and you don't really need that. If the scar's quite superficial and the skin and the superficial fascia is stuck down, that's where you need to work. And then you could use like massage tools. I use like facial cupping sets are really great. So not the strong cups, and I don't leave a cup stuck on a scar. But a pulsing with a cup is really good because it lifts and drops the tissue. So it flushes the tissue. It starts to separate and lift stuck layers. That's really great. So there's
what
a
about
whole
the massage guns? Do those are they too harsh?
I think you'd have to be really careful and think about what you're trying to achieve with it. If the thing I say is, if you're going to use something like that, think about where you're actually applying it, because where the scar is, the tissue's compacted on top of itself. So it's already shortened and compacted and pushed down. So potentially you could come in from the side with a massage gun and kind of try and get under and around the scar. But I wouldn't really recommend pushing directly down on a scar and then pumping up and down with a depressive force. The difference with the cupping is it's going up and down, but it's a negative pressure. It's lifting the tissue up rather than compressing stuff that's already matted. If you think about it as, like if anyone's got like a cat that's had like a mat in their fur, that's kind of what scar tissue feels like. Well, you wouldn't really want to come on with anything that's going to squash that further. So a lot of my techniques are like, let's back off the scar and kind of creep underneath it and get it to lift up, or let's come around the side, so there are techniques directly
untangling the knot, right, of that matted hair.
Totally, yeah. Or if you had a necklace that had all gotten in a tangle, you don't want to push it together. You kind of want to wiggle it around and get some space and then start to open it up. So that's the kind of concept that I'm trying to get people to imagine when they're working on the scar. We want to do everything possible to lift it off the body rather than to allow it to close in more.
So when people have those really deep internal staples, let's talk about those, of like when there's,
So there's you might be working with someone who's got mesh, who's got metal work inside, which could potentially be causing irritation to the body and an inflammatory reaction. But at the end of the day, we're not going to be able to we don't want to overly disturb that. So what we want to do is make the tissue as happy as possible with the fact that that's there. So again, it's about, calming. So
almost like when the bullet is stuck inside, right? And you're just like,
yeah.
okay, it's just going to live there. We're not going to take it out.
Yeah,
but
totally.
Let's make sure everything's mobile around it. Is that then the idea?
Exactly. Yeah. Keep things moving around it. Make sure that you haven't got any persisting edema. And often people with that irritation, maybe they're telling you at the end of the day, my leg's really puffy, or this is, by the end of the day, this is how I look like, and it's different from in the morning. So that would be a telling sign to me that something's really kind of like fluid flow around the area is compromised. And if you imagine, you've got a lot of superficial lymph nodes, and if the scar is kind of like literally like pinning those down and stopping through flow, we want to try and increase the space to try and help that, or potentially try and redirect the lymphatic flow around the area to see if we can find it a better pathway.
Oh my gosh, it's like that brings up so many other issues. Like, let's talk a little bit about that. So like things that might be showing up in the lymph, or even nerve entrapment. Can you, because I think like a lot of this stuff, it's not straightforward to diagnose unless we're looking through the lens of scar tissue. Talk a little bit about both of those things, about issues with lymphatic flow and with nerves.
Yeah. So when I first learned scar therapy and kind of added that, because I've been 30 years as a massage therapist this year, and I basically got a little bit frustrated with massage. I kind of thought my client base was a bit stuck, and then I discovered this whole world of scars and became totally obviously obsessed as you'll find out. And one of the first things that I started using this with was working with cancer patients. And one of the main reasons that I think that was just such a boom, a sort of wake up call for me, but also for the charity that I was working with as well, was that if you've got a very invasive surgery where you've got tissues being taken away, that's anyway going to be more complex than just opening somebody up and doing something more minimal. So, particularly things like breast cancer, bilateral mastectomy. And then on top of that, having the insult to the tissues of, it's halfway through healing to then have radiation, which means, the tissues kind of struggling to get better. And then literally somebody comes and kind of like fries it. And that really sets people back in their scarring and can lead to these, serious conditions. It can increase the incidence of axillary web syndrome, so cording in the arm, which a lot of people get, which is like the major theory is that where you've removed the lymph nodes, that you get a fibrosis along the fascial tissue through the fascial web, which creates like a string-like cord that can go all the way down into the lower part of the arm, so into the wrist, and it's inflammatory, and then they end up with lymphedema.
And this is happening too if we take the opposite end. If we're like uterine types, or like uterine cancer, colon cancer, any of that, do we have the similar cording?
It's less common there. I think the nature of the tissues and the way that the lymph nodes are harvested in the arm is where you get this presentation of cording. I've not come across it in the same way, but if you think about where that tissue would be, it's a lot deeper. So I think it's and there's less movement through that. If we think about how much stretch we're required to do through our axilla in order to get full extension and all of that movement in our arm, that being fibrotic is immediately easy to spot and really impactful for the individual. Whereas if you've got something deep in your pelvis where you've had a surgery, the pelvis itself is kind of sitting there, isn't it? And although the tissues need to move around it, it's not required through a smaller area to have such a dynamic movement.
Yeah.
So you often get more pelvic floor kind of, dysfunctions and things like that, and breath dysfunction after abdominal surgery or pelvic surgery. So it throws off the diaphragm pelvis relationship. So that's
then you get shallow breathing, right? So then you get shallow breathing, more anxiety.
Breathing. And when something's hurting, so if you've had any surgery in your torso and something hurts because it's knitting together, the way that you avoid putting too much strain on it is you shorten your breath. Yeah. Because if it hurts to take a full breath, you start taking short breaths. Well, if nobody comes back to you and says, right, let's get your breath back on track, you end up with short breaths. And what do you need to get your lymph flow moving? You need movement and you need good breath, because breath is one of the key things that moves the lymph. And this is why when I teach my courses, it's not just there's a scar, I'm going to show you some massage techniques for it. It's like, well, there's a scar, but what's the knock on that it's done to this individual. Let's watch them breathe. Let's watch them move. Okay, well, as well as just treating where the scar is, what can you see is happening when they walk, when they stretch their arms up, when they move their legs out, are their hips off? And you've got to look at that full holistic picture.
Oh yeah. I mean, I would even imagine if you've got an alteration of the breath and shorter breath cycle, shallow breathing, it's like, it's not a far leap to sleep apnea and a CPAP machine. And right. It's like all the downstream stuff from these scars, which we don't often even know we have it here. We don't have it adhesion. We don't connect it to, like, that's when I started getting bloated, or when I started needing my sleep apnea machine, or right.
And all of these young people who are, just having fillers and things like that, and stuff put in their body, that they're just assuming. And so because I've got a clinic in Harley Street, which is like the medical center in the UK, and so I get a lot of people who've gone through cosmetic procedures, and some of them are going through having these things put in their faces, and then their faces have a reaction. So what happens? You get fibrosis. So literally they're coming to me and they're saying, look, when I smile, I've got these lumps on my jaw because there's all this foreign tissue that's kind of clustered together. I've got people who, they said, at 19, I thought I'd go get a BBL. So they've got, fibrosis in the abdomen. They're not even thinking about how it's affecting, their nutritional intake with all that kind of irritation around that area. They're just looking in the mirror and saying, well, when I look, I don't like the fact that this looks lumpy and bumpy. And then, they're having fat moved from one place to the other. And it's like, these cells in our body, they're there for a reason. They're doing stuff. They have a function, and they're being sold these procedures with the view to a short-term win, and we're not really yet seeing what the long-term losses are. So it's going to be interesting the next 10 years as more of these people age.
Right. Yeah. I mean, yeah, it's interesting, scary. I mean, especially when we haven't even touched on, like, the microbiome underneath all this, but it's like, right.
And
then
what
we have this generation
does to your microbiome and all of the,
well, and then generation, the current generation's already been born with a deficient microbiome. So it's not even like they're starting off at 100%. And then it's like, what is it? Adding insult to injury. Oh my goodness.
And particularly, if we go back to that, we were talking about C-sections at the beginning, and, if in very historically, people whose pelvises didn't deliver babies would not survive birth. So we've got an increasing number of people. Not only are we getting more C-sections because of obesity and because of the aging population, women are giving birth much later, which makes them at higher risk, but we've also got body shapes which would have been kind of taken out of society because they weren't physically capable. And what happens hormonally when you actually give birth, and what happens to the baby when you give birth, and the chemicals that release the hormones and the microbiome. It's instead they get pumped full of antibiotics. So there you go and try and breastfeed your baby, which is going to be much harder now because you haven't actually given birth. And at the same time, and they don't often even tell you that you've had antibiotics.
It's just in the drip. It's just you just signed it away. Oh my gosh. Well, I'm so glad that you're doing this work. I just want to point people back to your website, restoretherapy.co.uk, where you have courses and free scar therapy, and you've got videos on YouTube. I guess, in terms of what we've talked about, it's like getting a sense of when your clients are coming in, like what surgeries they've had, getting your hands on the scars to see what's actually going on, if that's in your scope of practice, becoming educated on like what to do, finding, and if it's out of your scope of practice, finding the people in the area that actually are trained to do this. And it's subtle work, and it's habit-based work, right? And it's whole body, it's whole person, whole personality. There's an emotional level to it, I'm sure. So will you just talk about, in closing, a few of the, your favorite success stories of people who've come in? And what I'd particularly like to hear, just in the nature of this conversation, is people who didn't even know they had any sort of abdominal adhesions or scar adhesions or strictures, who weren't even thinking about a surgery they had, maybe years before, and how you were able to help them, and maybe how quickly you were able to help them.
I think the first thing that springs to mind there was a therapist that came along to the course, and while she was interested in scarring, I think she didn't really clock what was going on with herself. She'd had multiple pelvic surgeries, so I think there may have been like a C-section to begin with, and then there'd been subsequent surgeries because she'd had fibroids and things like that, and she was suffering with a severe prolapsing and with incontinence. And during her time when she was doing the training course, she was coming in with bigger and bigger smiles. And at first she was a little bit shy because she hadn't opened up about the incontinence issues. And she said, "Oh, I can't believe it. Like I'm able to get to the toilet on time. Particularly bladder was an issue. So I'm able to get to the toilet on time. The pressure's been relieved. And I wouldn't have thought it was the scar. I just thought it was, the prolapse by itself. But I think it was the combination of all of the tissues and the bloating that she was having, that she hadn't really mentioned that she had. So a lot of people don't mention symptoms because they've got so used to them. That's like the new normal. And then you treat them and they go, I didn't know that was happening. We had a lady come along and she had a treatment. When I teach, we often get people to have the free treatments. And this lady came along kind of as a favor to have a treatment on her C-section scar because her friend was getting one. And she was 9 years after her C-section. And after the treatment, with the people learning, you get them to write a little comment, how did you feel? Was everything okay? And she wrote, lovely treatment, blah, blah. And then she sent me this long email the next day. And she said, I didn't know every time I walked up the stairs that my scar pulled at my C-section until I walked up the stairs coming home from the treatment and it didn't pull, but that's been pulling for 9 years. And I just stopped thinking about it. And now it's gone. And I was just like, oh, that's so lovely. And there's just so many stories like that where, somebody's just said, this was there in the back of my, somehow like kind of tapping away at me and being this little irritation. And for some people that becomes chronic pain and they focus on it and it's absolutely rules their life. And with other people, they just blank it. But you take that away and they suddenly feel lighter, they feel better. Internal inflammation will be reduced. So all of those things. So it's amazing.
And it so speaks to regeneration, right? It's like they reawaken to like, I am regenerative.
I'm
right?
okay.
Yeah.
And it doesn't matter how old. I've got a lovely lady who's in her 70s who had a bowel obstruction. And I think because she's got diverticulitis and she'd had to have, so she'd had an ongoing inflammatory bowel condition. She'd had to have some surgery. She'd had a stoma, and then she'd had a stoma reversal. And she was just the most phenomenal woman. She would do yoga 5 days a week. She would do dance. She was a stage performer, and she came for 3 treatments. And the difference, not only in her symptoms, but how upright she was. She just would stand there with her amazing ballet posture and just say, I can do this movement again. And, so you're never too old to get improvements. And that's nice. And you can do children, it's, if you do this kind of thing, you suddenly start seeing a whole new world. It's amazing.
Oh, I love it. Yes. The power of regeneration. All right. Well, thank you so much. I'm so glad, Emma, that we had a chance to really dive into this powerful, powerful work.
Are you a podcast listener ready to guide your wellness business to more profit? We have an exclusive offer just for you, introducing our Unique Abilities Profit Consultation. Sign up today at wellnesspro.academy/unique. Don't miss this opportunity to unlock your profit potential. During this personalized consultation, your expert coach will guide you to discover just how much money you're leaving on the table from an outdated business model. Say goodbye to trial and error and hello to tailored guidance that leverages your unique abilities. Your success coach will work closely with you to create a winning strategy that aligns with your strengths and vision. Don't let the challenges of running a wellness business hold you back from more profit any longer. Up-level your leadership with our actionable strategies. Overcome hurdles. Receive innovative solutions. Take that crucial step towards building the profitable wellness business you deserve. Schedule your free Unique Abilities Profit Consultation today. But hurry, this exclusive offer is only free for our valued podcast listeners. Don't wait. Unleash your unique abilities and unlock your true profit potential. It's time to make your mark in the world of wellness. Sign up today at wellnesspro.academy/unique. Namaste and have a great day.